When are you going to have a baby? Just relax and it'll happen. I'm ready for a grandchild. These are some of the, these are a few of the sometimes well-meaning, but often intrusive questions and comments that tend to come from our friends and family when you're trying to have a baby, which is when you least want to hear them. And today on Lunchtime Live at the Center, Dr. Kim Crone, our licensed psychologist, is talking about how to protect your mental health when you're on a path to building your family. Dr. Crone, it's so nice to see you and have you back today.
Thank you. Thanks for having me.
Dr. Crone, these questions can be hard to shake off when having a baby is so present on your mind. It's just always on your mind. What can someone do about these types of questions?
So those questions are going to be inevitable. And what you just said, Ami, is a really good point. And that is that oftentimes they're well-meaning. So one of the most important things is to try to keep things in perspective. Remember that the person asking them is asking them probably because they're curious and actually care about you, and hopefully not just because they're being nosy. But reminding yourself of that, staying calm, taking a deep breath, and deciding maybe in advance how you want to respond to some, those types of questions. So whether it be a real general response like, oh, we're working on it, or yeah, we'll keep you posted, something like that, or even just silence. I mean, by not answering, by kind of turning away or changing the subject, that person hopefully will get the message that that's kind of off limits or not something you really want to talk about, and maybe take the hint and not ask again. So silence does go a long way, but I do encourage you to stay calm. Be prepared, have some pat answers that you give when somebody asks you questions like that. And those answers can be as detailed as you want. I mean, I say pat answers to keep them general, but if you decide to educate them and maybe teach them a little bit about what you're going through, that's totally fine too. But whatever feels right to you, that's what you do, because I really am sad when patients start feeling almost worse about what they're going through because of outside pressure and outside questions like that. So remember that you're in control of your response and your reaction to questions.
So practicing the answers can help with, because sometimes it just triggers you into like I don't know what to say, I don't know what to do.
Right.
So practicing ahead of time, that could be really helpful for that. That's great.
Is
there a way to, for someone who's brand new to this process, they're probably, especially if they're coming to our practice for infertility, they're probably used to some level of disappointment, but is there a way for someone to, what are some things to think about before getting started as far as prepping emotionally?
Okay, so realizing that it is an emotional experience is probably the first step. That it is we call it an emotional roller coaster. There's a reason for that. There are going to be moments of excitement, of hope, of joy. There are going to be moments of frustration, disappointments, and just acknowledging that and realizing that's just kind of sadly part of the process is, like I said, the first step. Another thing you can do, especially if you're doing this with a partner, is to talk through with them about maybe setting limits in terms of how much you talk about it together, what's good for you, what's healthy for you in terms of the amount of talking, because especially early in the process, you're going to have lots of questions, lots of things to, kind of use them as a sounding board for and talk through. And that's all fine, but it gets a little exhausting after a while. So maybe coming up with an agreement that, listen, we're only going to talk about this and our treatment for 15 minutes a day, 20 minutes a day, kind of get it out, make sure we vent about it, however it's going, good or bad. But we're not going to let it overtake our lives, because it can have a tendency to do that. So you want to set limits there. Also, just acknowledging what works for you in terms of coping strategies. So if there are things that have helped you in the past when you're really stressed, whether it be school or work or something like that, maybe identifying those before you start treatment, and think about how you might be able to build them into your lives. So things like relaxation, exercise, seeing friends now that the world is opening up a little bit, gardening, hobbies, whatever it is that helps you cope, don't forget about those things, because sometimes, and Ami, you know as well as I do, sometimes patients get a little bit too focused and kind of get tunnel vision about treatment, and they forget the things that help them feel better and feel more like a person. So before you start, it's kind of nice, just write a list about the things that help, so they're there for you when you need them. Um, Another thing I encourage people to do is to get educated about what their treatment is, what's going to be involved. There's a balance there. Too much information can be a little bit overwhelming, but having some information will help take some of the stress away. The more you know, the less stressed you are going to feel about it. Um, and avoiding taking on new stressors. So this is not the time to start a new job, make other huge life changes. There are certain things that you can't control, and sometimes in treatment it feels a little bit out of your control, but anything in your life that you can control, the better. So before you start, saying, okay, we're kind of good. We have our jobs, we have, home, whatever it may be. We're not going to add new things. We're not going to make any other big life transitions while we're going through this stressful process.
That's great. That's great to know, because it does feel, if, in my past experience, it feels like you're almost taking on a part-time job, because there's so much time and effort and energies and mental energy put into this time.
For sure. Yeah, it gets exhausting sometimes. Yeah.
How, just going back to the friends and family, should people share with them? How do you decide who to share with?
So I respect our patients' decisions about how much to share and who to share with, but I definitely encourage them to try to find one or two other people to talk to about this, aside from their partner in the process, because as we already said, it gets a little overwhelming for them too, and they're in it too, and it's a roller coaster for them too. Having somebody who's a little bit more objective, either a good friend, your mom, another relative, or somebody or coworker that you can talk to about this with, takes a lot of pressure off of you as a patient, and as away from your partner as well. Those people who care about you, you have to choose wisely. It has to be somebody you trust, not to share it with tons of other people if you don't want it to get out to tons of other people. But they can be your sounding board. You can let them know what it is that you need from them, whether it be just listening, supporting you in some other way, whatever it is that they can do to help, ask them to help you in that way. And I really do think that it does take a lot of pressure off, and it feels less isolating. This is such an isolating experience. And when you're not being open with your close family and friends, it feels even more isolating and more lonely, because these people who care about you and who you're very close to don't know this really, really big part of what you're going through. So that feels very lonely. And it's really just, oh, that's okay. But sometimes you can reel it back in and maybe not share all the details with them, or find one person who could be your spokesperson, so that you're not getting bombarded with questions all the time. Maybe you have one person who can be the person that, answers questions, talks to other people, lets them know what's happening, so that you and your partner don't have to be the ones who are being bombarded all the time, because that just gets to be a lot. That gets to be tiresome sometimes.
Is there a way to, and you might have said this because you froze for me for 1 second, but is there a way to maybe coach your friends and family on how to treat you, or how to speak to you, or what questions to ask or not ask?
Well, that word is a perfect word. Coaching them, letting them know what kinds of questions are very hard for you to hear or hard for you to answer, what kind of questions help, how they can support you, because sometimes those questions are all about trying to show you that they care and they want to support you. So maybe if you say, listen, how about you not ask me questions until I will let you know when I have news to share, but in the meantime, please don't ask. But you can support me in this way. You can let me know you're thinking about me. You can invite me out to dinners to get my mind off this some, whatever it is that they can do to help, and guiding them, coaching them about what isn't helpful, so that they get a clue. Because again, they mean well. They just don't always do it the way that feels right or is actually helpful.
They don't know what they don't know.
They don't know what they don't know. Yeah, it does take coaching. I think that's a perfect word for it.
Do you so for patients who are well into the process and have experienced disappointments or loss, how do you recommend staying positive, without this toxic positivity that people talk about, and engaged as well?
Yeah, I mean it's a little easier said than done sometimes, and I completely appreciate that. You know, as I said before, it's a roller coaster. When it's not going great, it's hard to stay positive, and I completely understand that. But keeping things in perspective, knowing that those bad days are going to pass, and you have things to look forward to. There's typically a next step, whether it be a different type of treatment, a different kind of medication, whatever it may be. There's usually something that your team can identify as a way they can tweak your treatment to make things maybe work the next time. And remembering that, in terms of keeping perspective, your doctor is always learning new things about you as you go. They're figuring things out, they're getting to know you better. And so again, that might open up some new options and ways to stay positive and have some hope. Um, Also, just acknowledging that it's difficult, and acknowledging that it can be upsetting, and allowing yourself to be with that, so that you don't try to push that past and try to force yourself to be happy, or being toxically positive, because that's not doing you any good. You want to kind of be in the moment. If it's a bad day, it's a bad day, and then the next day, trying to use the way you think, the way your cognitions are working, to really try to gain more hope. Think about, not catastrophizing some disappointment that just happened, but trying to, allow yourself to think about the things that are going well, or things that are, potential options in the future, so that you can keep your perspective a little bit better and not get so exhausted by the process. Not losing yourself. So all those things I talked about in terms of coping strategies, the things that help you, trying to stay involved in hobbies and things that you enjoy, so that that disappointment doesn't just overtake you. The more you continue to feel like yourself, the more that you are handling the stress appropriately, the longer you'll stay in treatment, if you want to stay in treatment. But if you need to take a break, or if you need to say enough is enough, we respect that as well. So again, it's mostly about keeping perspective, managing expectations, and then being honest with yourself about what's working and what's not.
Okay. Is there a way now? There are men and women both involved here. How can couples share the burden and recognize their different coping styles?
Yeah, so the recognizing of different coping styles is important. And I think just saying it out loud is important, realizing that everybody copes differently. We don't want to make any assumptions here, but yeah, men and women tend to cope differently, and appreciating that, realizing that that's okay. If your spouse is handling things differently, or your partner is handling things differently than you, it doesn't mean they aren't in this with you. It doesn't mean they don't care. They're just coping differently and handling the stress differently. That doesn't mean, oftentimes it's, the woman who's dealing with most of the stress with this. They are the more active patients. They're the ones going through this a little bit more actively, and it might feel like individually sometimes, especially when we weren't letting spouses in, like that was tough for sure. But acknowledging that you guys will handle that stress differently, and allowing your partner to be involved in whatever way he or she can, even if they're not the active patient. So if it's helping you make appointments, if it's being your cheerleader, if it's being the person who gives you a foot rub every night, make dinner, whatever it is that they can do to help you through the process, let them know what those things are. Just like we were saying with friends and family, sometimes it takes communicating with them about what actually helps, what's good, what isn't so helpful, so they can be part of it and be an active part of it with you, even though maybe they're not experiencing quite the same kinds of things that you are during treatment.
How can someone best work? What's the best way to work with the care teams their care teams at the center for their emotional need?
That's a really good question. I'm sure our nurses would appreciate knowing that you asked that question. So I think first and foremost, remember you're part of that team. I mean, as a patient, you're an active part of that. So not hesitating to ask questions, making sure that you're not making any assumptions. I mean, it's complicated, the things they're asking you to do, and the training that they give you, I think, is amazing. But there will still be things you don't really understand or a question you have about a medication. And I'm sure our nurses would say, always ask. Don't assume you know what you're doing if you don't really know what you're doing, because they want to make sure you're doing the right thing. So ask questions, take notes when you're talking to your nurse, when you're talking to your doctor. Go in there with questions that you want to have answered, but also take notes when they're giving you the answers, because you're stressed out, you're not listening so well, it gets a little overwhelming, and it really helps to write things down so that when you walk out of their office or you hang up the phone, or click off the telehealth session you're having nowadays, you have the information you need and you aren't wondering, oh, what did they say? I don't really remember. So that definitely helps. Um, Not taking things personally, not being offended if they ask you the same question every time they're talking to you. It's not because they don't know you, it's because they want to make sure that they have all the information they need to help make the right choices for you in terms of treatment options or give you the right information. I know patients do that. They're like, oh, my nurse asks me the same thing all the time. I think they aren't paying any attention to my treatment, or they don't really know who I am. And that's not the case. The case is that they have lots of patients that they need to keep track of, and they want to make sure that they're using accurate information when they're giving you recommendations or advice or instructions on things. So I guess also just being prepared, managing your expectations, knowing that everybody's working together to make this as positive an experience as they can, will, I think, help you just feel better about that team you're working with, and trusting them. You're in very good hands here at the center.
It's like Jenny Baker said when we had a live together, she said, we got you.
Yeah, I love that. That's exactly true. I think they'd all say that. We got you.
Yeah.
Yeah, and trusting that.
You know, it is sometimes, it does happen where patients or people can spiral into, constantly thinking about it. When should someone seek professional help? If the mental aspect of fertility, building a family, is just getting to be too much.
So I think the most important piece there is for you to be honest with yourself about when it feels like it's too much. I mean, first and foremost, if you're feeling unsafe, if you're feeling hopeless, if you're thinking of hurting yourself, absolutely get professional help right away. But aside from that, it's really about being honest with yourself about how you're doing. If the stress or the upset or the disappointments are getting you to the point where it's impacting your daily functioning, so sleeping, working, interactions with family members, interpersonal relationships, all of those things, if those are all, not all, even just one, are feeling like they're being affected by your level of stress or upset, I think that's a really good indication that, okay, I'm not handling this so well. I'm going to go talk to somebody about it. And again, you're going to have good days and you're going to have bad days. But if you're noticing that there's kind of a pattern that things aren't feeling so good, pay attention to that. Or if somebody tells you, I mean, sometimes when we're in the middle of it, we don't notice it, we don't realize it as much, but maybe a friend or a family member or your partner says, you're not yourself. I'm a little worried about you. That means something, because that takes nerve to say that to someone, and so that means something's up. And again, I think that's a really good reason to go talk to somebody. I mean, just getting it out, just being able to have somebody to vent to about this, whether it be a professional or somebody else closer to you, is incredibly helpful when you're dealing with the stress of fertility treatment.
Do you think if they were to seek out professional help, a therapist, someone like yourself, it's important to find
Oh,
someone.
my lights.
It's important to find someone who has a specialty in fertility, infertility, or is it important?
So it kind of depends. I mean, I think any therapist is better than none,
Mm-hmm.
for sure. You have to find the match for you. So realize, I mean, there's some research that says it takes 5 or 6 times to try therapy to find a really good fit for you. So even a general therapist who's a right fit for you could make a really wonderful difference in your life. I definitely believe that someone going through treatment, it helps to know, it helps to go to somebody who has a clue, instead of having to explain everything and answer tons of questions about what meds are like or what the process is like or a certain procedure you had to have done. It is really somewhat reassuring and comforting to know the person you're talking to knows some of that already. You still might have to explain some, but they get the basics. So I think someone who says that they work in infertility is a really good thing, but not necessary. Not necessary. Not something that that you absolutely need to find, but it could be helpful. Knowing that, I mean, if you look on Psychology Today and you're looking for someone who does this kind of work and they list infertility as one of their fields, it helps asking them what their experience is in that field, because sometimes somebody just clicks on that and it says infertility and they really don't know about this too much. So it's always worth asking questions.
Good to know.
Yeah.
What resources does the center offer to help patients cope with or cope emotionally during treatment?
So me, I'm one option, although sadly we've been so busy that I'm not able to take on therapy patients as much as I want to, but I'm definitely here to talk to patients, especially in crisis if they need me. We have wonderful, and I have a great referral list. So you were asking about people
Yes.
who are in this field. I mean, we do have a referral list. Most of the nurses have this list available to them that they can refer people out to therapists who do have an understanding about what our patients are going through. We have our wonderful support groups and Resolve support groups, Ami, that you are very involved in, that are still meeting the third. Tell me when they meet?
Well, it used to be the third Thursday of the month when we were live, but now it's practically every week, and they can go to the Resolve New England website for that to learn more about when it would be. But they're meeting a lot now because
Okay.
it's virtual.
Okay. Yeah, a little bit easier then. And I think those are wonderful because those are peer support groups. Those are patients who talk about have a clue. Those are patients that are going through treatment, have a really good understanding about what the other people in the group are going through, and can either advise because they've been through it, or help just again be sounding boards to talk through how difficult this can be. So I think those support groups are wonderful. And we also offer a lot of kind of complementary integrated health options. Ami, you are a wonderful one as a health coach. We offer yoga, we offer acupuncture. Our goal is to help patients, you've heard me say this before, help patients feel as good as they can during this process. And all of those things are opportunities for you to kind of keep feeling yourself.
Oh, that's great. There are a couple of apps that might be helpful as well. The Ferticom and the Fertistrong app. I'll put it in the comment section. Those can give you some good relaxation techniques. It gives you some things to say to people, finding humor in this as well. But take a look at those apps. I'll mention it. I'll put it in the comments. But Dr. Crone, this has been so informative and so helpful. I know a lot of people will get some good value out of this. So
I hope so. I hope so. Thank you for having me again, Ami.
You're welcome. And we will be back next week for another Lunchtime Live at this center. Be sure to check out our website at yukonfertility.com for any additional information, as well as a calendar of events to support your needs. And the Resolve New England website, you can go to that to check out any when their calendar of support groups are as well. So, all right, take care. Have a good week, and we'll see you next week.